Hello, I'm Dr Sanjay Panicker. I'm the founder of Amrita Homeopathy. We have two clinics, one is in Korumangala and the other one is at Marathalli in Bangalore. We specialize in hair and skin problems, respiratory problems, allergies, pediatrics and infertility. I have also authored a book on pediatrics. Yesterday was the book release. This is on pediatrics drug pictures, that is, it gives an idea about how to prescribe for children, and it is an illustrated book with a lot of pictures in it so that it's easy for doctors and for others also to understand how to prescribe in pediatrics. In sciatica, to say which is the best remedy is very difficult for a homeopath because there are no best remedies in homeopathy. We prescribe based on symptoms. It is not a painkiller. It is something which corrects the biological process so that the pain automatically comes down. So it is based on the symptoms that we identify. In homeopathy, it is very important to understand a few things before you prescribe in sciatica. The location where the pain is there. Is it right-sided? Is it left-sided? We have to take that into consideration because the medicines for right-sided sciatica is different. The medicine for left-sided sciatica is different. The medicine for sciatica pain alternating between left and right side is again different. This location is probably not very important as far as the allopathic science is concerned. So whether it is left side or right side, usually the medicine is the same painkiller or maybe a muscle relaxant. So whereas in homeopathy, it is very important to understand whether it is which side is affected, and also it is important to understand the direction of progression of the pain, whether it started in the ankle and moving towards the hip, whether it is starting in the hip and moving towards the knee, whether it is localizing in the calf muscle, whether it is localizing in the ankle, where it is settling down. So the direction above downward, or is it moving from below upward? So the way in which the pain is progressing is also important for us. It's again important to understand the sensations which the patient is having. Whether he is having excessive sensations like burning, whether he is having even slight touches becoming painful, or is there tingling sensation, or is there numbness. These kind of sensations, the remedies are different. In numbness, the remedy is different. Pain with numbness, the remedy is nephralium. So like that, there are different sensations which is very important for us to identify the remedy. Modalities are very important. What is modality? In the sense, what aggravates and what improves the pain. Modality can be like, what environment of the patient, what is there around him, whether the weather is warm, whether the weather is cold is again something which can aggravate or relieve the sciatica pain. What is the age of the patient or the stage of his life? Like an elderly man, the group of remedies that come up in sciatica is different. It's not one remedy again here, it's a group of remedies that we are thinking of. People who are undergoing menopause or people who are undergoing a post-delivery stage in life can have sciatica pain. The remedies that come up is different here. Again, if it is the position of the patient, in which position he is lying down, whether he feels better by lying down, he feels better by sitting up, he feels better by standing, he feels better by walking, again he feels better by slow walking, or he feels better by walking fast. These modalities are also important for us to identify which remedy to give to that particular patient. Again, the temperature. When you touch the affected area, whether it is cold or warm to touch, the remedies are different. These modalities are not very important as far as the allopathic system is concerned. Okay, but here for us in homeopathy, all these things, observations are also important. Applying heat, whether it gives relief. Applying cold, whether it gives relief. We need to know that. When you sleep, many patients when they sleep and wake up, the pain is more. Some patients when they turn in the bed, pain is more. Naxomica is a very good medicine for that kind of a presentation. But the most, like these modalities, multiple modalities are there which can worsen or improve a condition. Again, associated complaints. Many patients with sciatica can have associated skin problems like mottled spots on the leg. In such a condition, your sepia can be one of the remedy. When you have muscular atrophy, that the muscles are becoming thinner associated with this sciatica pain, the remedies involved are different. And when you have a paralytic effect, that is, the person is not even able to move the leg subsequent to the injury or something like that, then the remedy involved is different. Post injury, the remedies involved, hypericum, arnica can come up in sciatica. And if you have associated diseases like if the patient has some cough or sneezing which is aggravating this, the remedy is different. So sometimes even the jerk can aggravate. So all these symptoms are very important to identify the remedies that is required in sciatica. Though the common medicines that are used blindly is often colocynth for left-sided sciatica and Bryonia or Stux for right-sided sciatica, Magfos for right-sided sciatica. So like this, different types of remedies can be blindly prescribed based on just one symptom, which may work, may not work, or can complicate the situation. So it's always better in conditions like this to meet your concerned doctor who is nearby to you, and they can help you better in identifying the remedy for your sciatica.